Okay, thank you everyone for joining. Sorry about the technical difficulties this morning. I'll just give people a couple more minutes to join.
Thanks, Sarah, for figuring that out.
How's the summer been, Matt?
Good. It's been hot down here.
Yeah, absolutely. Whenever I think of it being hot here, I just think it's about like 5 degrees hotter down in St. George. Yeah, over the weekend it was hot. I made the mistake of doing the work to clean inside the house in the morning. I should have been outside in the morning, but so I was outside in the afternoon, and I did not last that long out there. It was too hot. I don't have the stamina to work in the heat that other people do, I guess.
Yeah, down here you got to wake up early and get stuff done, and then you realize the value of a siesta, or at least the origin of the siesta.
Yeah. A few weeks ago, I was in Bryce Canyon vacationing, and I told I had some, it was a high school graduation celebration, and I told the group that I had with me, these teenagers, hey, it's going to work really well if we get out early. So let's get out and hike early. And we did what they call the Pickaboo Loop. That's about 5 miles, and it was hot. And and the last part of it is just a slog as you go uphill. And yeah, we were all out of water, ready for refreshment after, for sure.
Awesome. Well, did you enjoy the view though?
Oh, it was outstanding. The sunrise is just, that's one of my favorite spots there is Bryce Canyon. And so somehow I talked my high school graduate into making it his high school graduation present with dad. And so he had never been there, so it was fun to spend it with him. And we did a little bit of stargazing with a telescope down there, and went to the rodeo down there. I didn't even know they had a rodeo, and they got a little rodeo they do down there,
And some live music. I don't know if you've done the live music at the
they
hotel.
do have that. We didn't get any while we were there, but I know, yeah, they do have some concerts and great live music down there. And it's just like a place, it seems, that's like no other I've ever seen, as far as the hoodoos and all the beautiful spots there.
Yeah, so one final word on that. If anybody listening, if you want to go to Bryce Canyon, it's awesome. Go to the live music they have, and then go through Wayne County. I recommend Highway 12. I don't know if you did that, Rich. Go from Capitol Reef National Park to Bryce. That's
okay.
through Escalante and Boulder.
Uh-huh.
Well worth your time. It'll add 3 hours or your drive, but it's well worth it.
Yes, just have air conditioning and some cold beverage as you go through, right?
Yeah, Matt, my grandma has had property in Boulder, Utah since she was a little girl. Her grandparents owned a bunch of property. We go down there every summer, and I tell everybody to drive through there because it's the most beautiful place ever.
Yeah, Highway 12 is one of the prettiest drives in America. I mean, you've got the coastal highway in California and Oregon, and you've got Highway 12 this way. Okay, cool. Well, thanks everyone for being here. Again, thanks for Sarah for making the last minute arrangements. I think we have everyone that's supposed to be here anyway. So I'll read the standard introduction and then we'll get underway. I have it here, but Sarah, you usually post the introduction slides, don't you?
Yes, sorry about that.
So this meeting is the Cannabis Research Review Board. It's being held virtually and is hosted by the Utah Department of Health and Human Services, Center for Medical Cannabis based in Salt Lake City, Utah. Public notice of this meeting is provided as required under the open meeting code and posted on the Utah Public Notice website. The purpose of this board is to review the available research literature and assist the Utah Department of Health and Human Services and Center for Medical Cannabis in their efforts to provide useful treatment recommendations to qualified medical providers regarding the use of cannabis and cannabinoid products for treatment of certain medical conditions. Live recordings. This meeting will be recorded as in compliance with the Utah Open Meetings Law. It will be posted on the Utah Public Notice website within 3 business days. Written minutes will also be prepared for the meeting, and approved minutes will be posted at the Utah Public Notice website within 3 business days. And so that's one of our agenda items is to approve last meeting's minutes. The board members include myself, Matthew McKiff, Michael Moss, Misty Smith, Russell Cashin, Melissa Chan, and Taylor Kelly. Well, we're going to introduce Taylor Kelly in a minute. And the DAHS staff, we appreciate Dr. Hoffman, Michelle Hoffman being here, the Deputy Director, Rich Osborne for his input as Director, Sarah Dash doing everything technical, and Lauren Heath for her expertise in research. We are so grateful for that. At the end of the meeting, we will have a 2-minute public comment period. For any public comments about the meeting or the topics on the agenda for the meeting, please select the raise your hand function on the Zoom or virtual software in order to be put in the queue for comment. You have about 2 minutes for comment. Please state your name and if you have any affiliation to any organization, and then state your comment. The board will reserve comments on each public comment toward the end. Yeah, as a courtesy to everyone participating, please place yourself on mute unless you're actively speaking to the group. And then board motions and votes will be recorded in the minutes. So now we will initiate the agenda or initiate the meeting. But Sarah, I think I'm going to reverse agenda items 2 and 3. I think we should start with the introduction of Dr. Kelly, and then we'll move to the minutes because I have some comments on the minutes.
Yep, that sounds great.
Dr. Taylor Kelly, would you please introduce yourself however you can to the board and let us get to know you a little bit?
I'm happy to. Thank you, Matt. My name is Taylor Kelly. I'm on the faculty at the University of Utah in general internal medicine. I've been here about 5 years in this role. I've been participating in medical cannabis research now for a couple of years. That I've done some work in kind of the policy and research, and I'm part of a project that is collaborative with the Center for Medical Cannabis. And that's really been both fun and I think very meaningful work to do. And, out of that opportunity and kind of working in the clinical space in primary care, this opportunity came up. So there's several of you that I know here, and it's good to see your faces, and I'm looking forward to getting to know the rest of you. And yeah, happy to be here.
Thank you, Dr. Kelly. I'm delighted that you're here as another primary care doc and participating in cannabis, both research and clinical use. It's nice to have another colleague to be participating in this board, because this board has been really interesting to have researchers and clinicians alike to discuss these issues. So that's great. So welcome. Any questions for Dr. Kelly or lauds, accolades from the board?
I'll just add that like every one of the board members, the department is so lucky to have you on the board. We're fortunate. We're glad that you were willing to take on the assignment, Dr. Kelly.
Oh, thank you. I feel privileged to be here.
Matt, should we all introduce ourselves to Dr. Kelly?
Yeah, why don't we do that? Yeah, so why don't you start, Mike?
Sure. Hi, Taylor. I'm Mike Moss. I'm here at the U as well. I'm medical director of the Poison Center. I do toxicology, addiction medicine with our inpatient service here at the U hospital, and emergency medicine, though I'm not working in the ED now. Mostly poison center and addiction is what I do. Been on the board for a couple years, something like that. Vice chair right now.
Perfect. And why don't we go, let's see, Dr. Chan, could you introduce yourself to Dr. Kelly?
Yes, sorry, I accidentally hit share screen and I don't want to do that. Okay, I am a primary care doc in the community with Lotus Health. I'm addiction board certified, family board certified. Yeah, that's me.
Perfect. She's also has experience in treating patients with cannabis and in another state, right? In setting up a cannabis program or
Yeah.
at least research in another state. So
Yeah, in the Bay Area, I helped with Sutter Health and Kaiser.
perfect. Okay, Russ Kashin, do you mind going next?
Sure. Russ Cashin. I have a doctorate in nutritional psychology. I'm an educator over at Utah Tech, as well as Mojave Community College.
Perfect.
I teach cannabis over at Utah Tech, by the way.
All right, Misty.
Hi, I'm Misty Smith. I am at the U as well. I'm an assistant professor in the College of Pharmacy, where I'm also a co-investigator in the epilepsy therapy screening program. I also have a joint position as an associate professor in the School of Dentistry, where I teach pharmacology. I'm a member of this committee, obviously, but I'm also on the Medical Cannabis Policy Advisory Board and involved with the steering committee for the Cannabis Research Center here at the U now.
Excellent. And why don't we do two more? Dr. Hoffman, do you mind?
Sure, Michelle Hoffman. I'm the Executive Medical Director at the Utah Department of Health and Human Services and a Deputy Director of the Clinical Services section, where the Center for Medical Cannabis, among other clinical functions in the department, resides.
Fantastic. And then Lauren.
Hi, Dr. Kelly. My name's Lauren. I'm a pharmacist working at the U in the College of Pharmacy. I have a background in pharmacy and health services research, and I've been helping with the CRRB since, I think, 2019 in some capacity.
Yes, Lauren, you're probably our longest standing member of this board, and your participation or your contribution is significant. So thank you. Or at least as a consultant of the board, right?
Right.
Okay. Well, thanks again, everyone, for introductions. Hopefully, Dr. Kelly, you can feel right at home. I feel privileged again also to be part of this group. It's really a great group of clinicians, researchers, and minds in this very important topic in our state. So let's move to back to agenda item number 2, approval of the April meeting minutes. I hope everyone had a chance to review them. Yeah, Sarah will put them up there if you want to review them quickly. Are there any questions or concerns about the minutes? All right, no concerns. Do I have a motion to approve the minutes?
I'd move to approve the minutes.
Misty motions. Do we have a second?
Second.
Second.
Dr. Chan and Dr. Cashin both tied for second. Before we vote, we have to have one more call for any discussion. Any discussion before we vote? Okay, hearing no discussion, I move we vote to approve the April meeting minutes. All in favor, raise your hand or indicate. Great. Any opposed? Fantastic. So as I said, I had a comment on the minutes, but not as to their approval, but as to how we use them. So Sarah, would you mind scrolling down to the bottom? After our meeting and our public comment period last meeting, we had some really great feedback summarized. Where was that on the minutes? Yeah, number 9 on public comment. Am I looking at the wrong minutes?
So you might have been looking at the January ones earlier. I had them accidentally uploaded to UPN and I switched it. So it might have been on the January one.
Maybe that's the January minutes. Yeah, the January minutes. Anyway, I just had a quick comment. One of the purposes of minutes is not only to record what we did, but to record assignments and follow up on those assignments. And so I looked at the January minutes and noticed how we had all this great comment on research and some of the flaws of the research. We review all this cannabis research, and Lauren's reviews are fantastic, but it's striking that sometimes the section on her review on limitations of the studies is longer than the methods or the results section. We've often made comments about how, oh yes, this was a good idea, but there were variations in dosage, variations in product, variations in follow-up, and all these problems with research. I thought, well, why don't we take this as a review board? Why don't we take this list of things that we could present to the Utah Cannabis, the research, the new board, the Center for Medical Cannabis, University of Utah, or other places that are going to conduct research, like our top 10 wish list of things please don't do if you conduct new research in cannabis. Here are the flaws that we keep seeing, and could you please try to correct some of those issues? Does that sound like a worthy product? Kind of like we've had the top 10, like Mike put together the top 10, side effects or things that we should, dangers of cannabis. And we talked about the top 10 things to consider when selecting patients. What if we had a top 10 list of things to not do in conducting research? And I was going to ask Dr. Cashin about this. Go ahead.
Well, it's funny you say that, because in our last minutes, if you look, Dr. Viner and I both commented that they don't talk about even the types of cannabis they're using. Administration is often an issue. I think this is a great idea. I would love to have more influence on how research is conducted, especially in this state, because I think there's a lot of things that researchers don't see from the patient point of view or the clinical point of view.
Yeah, exactly. So would you mind taking this on, Russ, as a project and come up with a list to maybe present to this newly formed University of Utah Center for Medical Cannabis, or I can't remember what it's called, this new body that's going to either review or conduct their own research, and sort of a top 10 list of that. What do you say, Russ?
Sure. I mean, there's already things I can think of, but I'm looking at last month's minutes. You say there's some more in January as well. I'll have to look at January.
Well, that's the January minutes right there.
Yeah, I just pulled those up.
Oh,
yeah.
You pulled those up? Okay.
And Russ, if you have time, you could also listen to some of the audio, and actually Abby might be able to help you know at what time in the audio to listen to. It might save you some time.
Okay.
And so you could kind of listen to some of the verbal discussion and some of what Lauren and the board picked up on at the time in January. That might help too. And I know Valerie with the University of Utah Center for Medical Cannabis Research, she is in the meeting right now, and I'm sure she'd be willing to accept any thoughts the board had as the person that's helping as a liaison with the board. And same with I know Taylor has some relationships there as well.
And Misty had her hand up. I bet Misty could just rattle off 5 things right now, the problems that we see in research. So could Lauren, right?
Well, I just wanted to comment too on this list, in either Rich or myself can update the committee. But from this January minutes, it said where I'd commented that there should be a recommendation on improving access to products in the state. And there's actually been some progress there. I worked with Brandon, and Brandon and the other members of the Department of Agriculture actually were able to adapt some of the regulations to improve access to cannabis products so that they could be transferred between Schedule I license holders in the state for research purposes. These are products that are scheduled for incineration or elimination after doing quality assurance assessments. And essentially this will give access to researchers in the state who are appropriately licensed to access some of these actual medical cannabis products for research purposes. Those who are interested will just need to reach out to Brandon Forsyth at the Department of Ag. And otherwise, it is a Form 222 transfer as if you were ordering a Schedule I compound through any commercial vendor. It's just a direct transfer from Schedule I to Schedule I license holder to Schedule I license holder. If that's helpful.
Great.
So we've made real progress as far as access to medical products for research.
And that's important to have consistency of product, right? If we want our research to be high quality, you got to have a consistent product, consistent dosing so that we can draw better conclusions. So,
well, the nice thing about this is we will have that that quality control information. We'll know from the certificate analysis exactly what's in the products that are being evaluated.
Yeah.
Okay. Well, thanks, Russ, for being willing. Like I say, this board is loaded with talent. So if you just get us started, like I say, Lauren does this exhaustive review, and she could probably list all the flaws that she sees over and over and over again in all these studies. And maybe we could change the course of research to be higher quality.
Well, and more relevant to what our clinicians and our patients need, you know, both in terms of information and in terms of medicine. So my understanding from what Misty just said, that the products would be actually products that patients would be using. They're just, after they pass the quality control, they'd be passed on to the researchers.
Well, it wouldn't be passed on. You'd actually have to apply through the Department of Ag. So you would request from Brandon and do a transfer as if you were ordering it from any supply house.
But these are products that patients actually use, right?
Correct.
Yeah, that's important too, I think.
It's a huge step forward, and I don't know of another program anywhere who has access such as this.
Yeah.
Now, when you do that, you're taking on, you know, from diversion control standpoint, I'm thinking like a DEA agent here. You're taking responsibility for that product and securing it, and like you would any other Schedule I compound that you are receiving from a commercial supplier, and you'll be responsible for the record keeping after you take possession of it. So, but otherwise, it's just a transfer from Schedule I holder to Schedule I holder. Will
that change if the scheduling changes at the federal level?
It would still be a transfer. There's not a Form 222. You just would have to be able to document the exchange. So as you know, DEA doesn't use a Form 222 for anything below a Schedule II. So yeah, so you'd still be able to transfer it. It just wouldn't be through a Form 222. You'd have to they don't really have a transfer form. I know for our program, we have created documents so that we can show the line of, I forget the terminology, where it's going from one person's responsibility to the other person's. It's kind of like evidence exchange. You have to be able to track it from point A to point B and know who's responsible for it.
And Misty and the board, if you wouldn't mind, I'd like to reach out to Dr. Forsyth at Department of Ag and have him put together maybe a written summary of how it would happen.
I think
right?
that's a wonderful idea.
And under the laws that exist, here's how to appropriately do that. And then we can maybe circulate that to Valerie
Yep,
at the University of Utah Center for Cannabis Research.
yep.
And we can have just some clarity about it so people can understand it better. Great. I'll follow up with UDAF about that.
Fantastic. Thank you.
Yep.
So this could get detailed very quickly, but I think this is a good initiative for our board to adopt because we haven't focused on this before, but it seems a waste to not do something like this. All the expertise that we have in this group and not pass that on as we embark on a whole new era of research to kind of direct them into where the pitfalls may be. So thank you. All right, so there's no more discussion on that. Let's move to number 4 and turn it over to Rich for our update on the new EVS system.
Yeah, so I can be brief with that. We're right now set to launch with our new electronic verification system, EVS, built on the Salesforce platform. That'll happen in early August. And right now we've been working with some external expert users to test the system to help us identify little wrinkles that need to be fixed or things that long-term we may want to think about changing in it. And so it's been good to get their feedback. We've been able to work very closely with the Utah Department of Ag and Food, as their side of it is the inventory control system hub, which will connect through API integration with each of the softwares of the point of sale systems of the medical cannabis pharmacies. And so that part of it is going through the testing now, and one of the most critical connections is that connection between the inventory control system hub and the point of sale system. And fortunately, the majority of the pharmacies have decided to go with one particular point of sale system, which makes it a little bit easier, but there's still a lot of API integration that needs to be built by their vendor in order to make sure that we're having all the data from those point of sale systems transferred into the Salesforce inventory control system hub that's been built. So we're really excited about the new system coming out, and some of the other items that relate to that rollout that we're really looking forward to are just that the data that we are housing in the Salesforce platform will be, we expect it to be cleaner. We'll also know better how to manage the reports that are done on our end regarding the information about recommendations and which product is being attached to which patient. But then on the side of the Utah Department of Ag side with the facilities, they'll be we'll be better able to track the medications, the medical cannabis that's purchased on that end as well in a cleaner way. And our expectation is that it'll be better prepared to use for appropriate research purposes in the future under the appropriate permissions. And so we're looking forward to that. So that gives you a little bit of information about the launch of the new electronic verification system on the Salesforce platform. And we've had some other states reach out to us because they're curious about how we're using Salesforce for these purposes. And we're looking forward to being able to share information with them once our launch has happened that they may be able to benefit from as well. Yeah, so that just gives a brief update about the new EVS system launch and go live that's scheduled for early August. And there'll be some training sessions, by the way, that we'll be inviting medical providers and the employees at those medical clinics to join coming up about 2 weeks prior to when we go live is when the time will be for those individuals to get trained on how to use it. And so immediately before they get trained, and then they'll be able to use it to help their patients. And so, yeah, as far as cannabis rescheduling is, I think everybody is aware, the DEA has filed some proposed rules, and they are just that, proposed at this point. And anybody can go and get a copy of what those are proposed to be. And there's a public comment period that is happening right now, and individuals can submit comments to the DEA to share their thoughts about that rescheduling. One thing that regulators, us in Utah and counterparts in other states are hoping for is some additional guidance about those rules, something similar to what was called the Cole Memo that was done years ago when the cannabis companies were trying to figure out how to do banking. They were able to get the Cole Memo that helped them understand how to do that with the feds knowing what was going on above board. So we're hoping that we'll just get some guidance that'll help regulators like us and also companies that are involved and potentially researchers will have some additional guidance. We're just hopeful that they'll provide some of that so we won't be left to interpret things on our own. But that was a subject that came up last week at the Cannabis Regulators Association meeting that I was a part of. And although there's some expectations about how the rescheduling will impact the industry, there's some things that we just don't know at this point. But one of those expectations is that the cannabis companies will be able to write off their business expenses on their taxes. And so that will be a benefit, obviously, to the industry because they're not able to have the same tax benefits that regular companies have. And then there's an expectation that there will be more researchers interested in conducting research just because of the fact that if it moves from a Schedule 1 to a Schedule 3. So there's that expectation. And I think just the fact that the federal government would be recognizing cannabis as having at least some medicinal value is an indicator of potential research that would happen more often in the future. So anyway, as far as immediate impact on the program, though, there won't be much immediate impact even after it goes into effect, just because the medical cannabis that is sold at the medical cannabis pharmacies in Utah is still just non-FDA approved medication. And so, and it still would be a controlled substance. And so for that reason, it's still federally illegal. But it could be that this change prompts momentum for other federal changes. We'll see. So we'll keep the board posted on any developments, and you'll probably likely hear through the media any additional developments that come through that as it goes through the rulemaking process and a potential rule gets published, and we can have further discussions about it at future meetings as that happens. Any questions? Okay.
Well, I just have a comment. Thanks, Rich. I think you're right. I think that as far as rules and policies, very little will change. Maybe the research, it'll accelerate some research opportunities and some policy changes, but public opinion, maybe that'll instigate a lot of public opinion changes, or at least discussion. And from our point of view, maybe that might just be an opportunity to disseminate more of our education initiatives.
Right.
Capitalize on that media. I don't know if it's gonna be a storm, but at least there will be some coverage, and then maybe we could capitalize on that.
Right. And it's just wonderful that we've got a University of Utah Center for Medical Cannabis Research recently created that I think is gathering some momentum as different researchers get involved with that. And, we're hopeful that there can be even additional research that'll help guide medical providers and patients. Great.
Excellent. Okay, so we're back on schedule, 9:45. Mike, are you ready to talk to us about your safety document? I made a few edits this morning. I don't know if you had
Oh,
chance.
perfect. No, I have I've not looked. I sat right down to this meeting this morning, so I haven't looked at things. So this is something I drafted up as we talked about, well, Matt's thing about talking to patients, and I had all these thoughts about safety and adverse drug reactions and drug-drug interactions, and realized very quickly I was just gonna like end up creating a whole new document just to address that. So here we are. This is my take. Like I said, I only hear about weird stuff and like bad stuff, so I need to get the normal side of things from you guys who do this every day and talk to patients about it, from those who are educating, Russ, Lauren, Misty from pharmacy and pharmacology side of what you might think, that I came up and sat down of what did I think could be top 10. I think I only have 9 actually, things for people to be talking about. There's 10. I made sure to get a 10 in there. Okay.
That's what I added. That's what I added this morning, Mike.
Oh, nice. Yeah, so we can briefly go over this. I would like some, input from everyone on even tiny little word changes of, oh, I think the most important side effects are these 2, so I would list those first. Or, I find patients end up having trouble with this, and this is what causes people to stop using cannabis is this thing, put any of those in there. So started with common adverse effects, some particular contraindications, some things about cardiovascular risk. The drug-drug interaction section could obviously be huge and cannot be exhaustive there, right? It's mostly make sure you discuss your medications with your doctor and the pharmacist. I have to put something in there on driving safety, some ideas about withdrawal, patients who could develop a cannabis use disorder, specifically cannabinoid hyperemesis syndrome, though you could see putting that into another section. From my poison center side, making sure that the rest of the people in the household don't get exposed to cannabis, like the little kid or the someone else who decides to eat a gummy not realizing what it is. Yeah, underage use, this is what you just added. I think that's great too, about what do we do with adolescents, and are you gonna be sharing that with your kids or something like that? I don't know if you've heard of that, Matt, have decided, well, my son had this, so this has worked great for me, so can I give it to my son for this as well?
16 to 17-year-old kids with anxiety get it from, and it's just a bad idea. So I thought we had to put it in there somewhere.
No, that's fantastic. I like that perspective, because I wasn't thinking this from the medical side, of course, because compassionate use board, there's that pathway, but obviously there's ways around acquiring it officially. So I like that. Taylor, you got your hand up there.
Yeah, I was just gonna throw in, 2 cents having gone through this. Just there's a few things I thought that could potentially be baked into these categories, and some of them might be stating the obvious, but we don't actually say anywhere anything about neurologic side effects, which I think are kind of the most common and probably the ones most people know about. But things like altered senses, impaired movement, impaired thinking and memory, those are common. And I mean, that gets at like the driving issues and some of the other things. But talking about that, I think would be important. Even adding like hallucinations to paranoia in the first one, because that's another thing that people can and do get from cannabis. On the underage one, I was glad to see that one was added. But maybe saying something about the potential effects on the developing brain. You know, we do have some pretty good data about that. And so one of the reasons younger people should stay away from it is because we know it does affect the developing brain. And we talk about pregnancy, which is good, but I think saying something about that, you know, there's reasons why kids should not have this would be good. The only other thing I had was that we talk about cannabis use disorder, and I didn't know if we wanted to define that a little bit more. There's a lot to say about that, and it's very nuanced, but you know, maybe giving someone an idea about what it is in like a general sense could be helpful.
No, I think that's good. We could add just like another line about this, because obviously any one of these could be an entire review paper,
Yeah.
right, on all the
Right,
details
that-
of the things that are
That's
there.
the
And I
challenge.
got kind of goes to another point we can talk about in a minute too of some other things. But if anyone else has other comments, Misty, you get your hand up.
Yeah, I'll just mention that a publicly available website through drugs.com as far as drug interactions. Students have found it useful. They actually have a cannabis interaction checker. Obviously, the first choice is always to speak with your physician, but if somebody wants to do a quick check, that it lists over 400 known interactions, breaks them down into major, moderate, or minor, and kind of describes them. So it's just you can access it through drugs.com or you can look up cannabis drug interactions.
Great, because if you ask your physician, what are they going to do? They're going to pull up a drug interaction checker and put your drugs
Exactly.
in there.
So it's a really handy free website
Yeah.
that does a thorough job.
Cool. Let's we can include that. Dr. Hoffman.
Sorry, it took a while for me to find my mouse. On the cannabis use disorder, I just, you know, whenever we're quoting statistics about adults, I just want to remind us that we have youth who also get compassionate use medical cannabis cards. And so if we have statistics on youth, we probably want to include those as well. I do believe, and I'm not an expert in this space, but I am a pediatrician. I think that the risks are a bit higher in youth than in adults in terms of developing a cannabis use disorder.
Yes, that's right. And it's the earlier you start, the more likely you are to develop a cannabis use disorder over your lifetime. Yes.
Probably
Yeah,
be a good phrase to throw in there, Taylor.
I like that because that was part of that underage category was that if they start using it underage, then you've got way more time to develop any of these complications, especially cannabis use disorder. But the earlier they start, the worse it is. So I didn't know how to be very concise because part of the point of this document is to make it short enough to memorize, but long enough to have helpful information or at least point to resources where they could learn more. But it's meant to be a tool that could be one page.
Yeah, I'd like as much as we can to keep each of these to like 1 or 2 sentences under each of these subheadings, and then, you know, link to additional information.
Yes.
Which kind of gets us to the next piece as well of, you know, what other information should we be linking to? What kind of like we could come up with a million citations and references for each of these points. And is there a way for people who do want to get some more to quickly get to some other easier to access resources that we could put in here? And, you know, to what degree should that be present? Should those just be on the website? Should there be a second page here where we have all the, you know, further information, see this area? What else should be on there for to back all of this up?
Well, I agree, Mike. I think that the second page should just be links to good resources that are both clinician and patient friendly. I mean, not scholarly research like we review, but you know, articles that are from trusted sources, but that are complete enough. So that might be hard to assemble that list, but I think it's worth doing to point people in the right direction.
Yeah, Taylor said NIDA. I know CDC has some good things that I've pointed people to before as well. So if anyone has any of those, please send them to me or to Sarah, and we'll kind of collate the best of all that, or the some of the easy things to send people to. And I guess our target audience for this, I was kind of intending this to be a little more towards the provider side, but also understandable by any patient that could access it as well. But I'd be happy to have thoughts of, should there be a patient one and a provider one, or should we just stick to this document, which is a little bit more on the provider side?
Would the idea be this would be like a waiting room handout, you know, like they have those things when you're in a clinic and there's all those little papers about different topics, and you could grab this one on cannabis and look at it if you're a patient, maybe. Or maybe do we need something a little bit more provider oriented, like you're saying?
Yeah, so maybe there could be two pieces. I think the idea was this would be maybe something on our the CRRB website of, here's Matt's how to talk to your patient about cannabis, and then here's how to talk to them about safety things. And then we can make a patient education one that gets our, verbiage down to more that, like, standard reading level, and we don't say things like palpitations or orthostatic hypotension in this.
And
Yeah, I think the initial intent was this is for the provider, but to talk to their patient with, so they have it in their room, like, let's go over this right now. So it's simple enough that you keep it in your pocket and then be able to talk about it with patients.
right. Just one thought, if I could add, is some advice that we've gotten from our communications office here at DHHS is, when we're creating something that's intended for medical providers, to write that in the plain language that we would expect a medical provider to use when they're communicating directly with a patient. And so essentially, there's really not a difference in the language, because they don't have to like translate it and put it into different language. They can just use the language that it's in the document that we, as an agency, share with them, or that they find on our website, right? So one suggestion is just to put it all in plain language at that reading level, so they can then not have to think about it. They just pass it on, and of course in their own words sometimes, not verbatim, but we just put it in plain language so anybody could understand it. Right.
I agree. I actually can see using this in my education class, frankly.
Yeah.
Yeah.
Same.
One thing I could do, Rich, is we have a couple of health educators here at the Poison Center, and their entire job is public communication and getting things to an understandable reading level. And whatever I write, they say, Mike, you have to take out half of these words because you need to have it at a middle school reading level for people to understand. So I'd be happy if you guys are willing to, and if they're willing to, send it over to them and ask them to take a look at it for easy reading purposes.
Yes. And I think one objective we can work with the board on is like consolidating some plans that we have at DHHS to provide resources to providers, consolidating that with what the board is putting together here, which is wonderful. And we want to incorporate these same principles in what we're doing. And then also coordinating with University of Utah, because they have a role at the University of Utah Center for Cannabis Research in helping us create resources for medical providers. And so I think we can take this and use it to help us frame something that we use to create a united voice in saying, hey, these are things that you need to think about as you recommend cannabis or use cannabis.
Valerie, do you have anything to add on that? I suppose if you brought this to CMCR, it would then just be me and Misty mostly, but if there's other people that would want to take a look, or if you think Jerry should have a look at it too, from the CMCR side or whatever you think. I'd be happy to have as many different stakeholders take a look and weigh in as would like to.
Yeah, we could definitely add this to our list. We just finished some content videos, and thank you, Dr. McKiff, for helping us out with that. So we'll be posting those and getting those over to you guys. So we're moving into the next phase of what we want our education to materials to be. And we had the intention of doing some one-pagers. So this could serve as an opportunity for us to do a one-pager that we then disseminate and host in our resource library as well. And we could do a quick review. I think, yeah, basically it would be you, Michael and Misty, and then I'd love Russ to also take a look at this. And then we could have Jerry get it out and see if there's anyone. Now, Taylor, I'm so happy you're here. That's wonderful. We could potentially have other folks within the U's network take a look and just give any feedback or comments, and then get a one-page summary put together.
Great. So it seems like this is ready for making a few tweaks and then sharing with some stakeholders to get some input so they can use it as a resource.
I'd be happy to clean up things here, aim to kind of keep it at this 1-page limit, harmonize language to be a little bit more friendly for both providers and patients, and then take any other resources that we want to link out to add to a separate page, and then we can kind of get additional approvals and insight from the board and the other folks who want to be involved.
Yeah, that sounds great. So if we can help Mike in providing some links, like I say, we don't want scholarly research links. We want links to patient-friendly web pages that say this in a more complete manner and also has research backing. So I use FP, familydoctor.org a lot with my patients, that's what that's for. I'm sure there are other websites that are friendly. Russ, you probably have a lot of websites that you might use. If the Department of Health or the U of U has websites that are very patient friendly, this is where they would be linked. So let's all give Mike some help.
Yeah.
Okay, well, thank you, Mike. Let's move to our next agenda item, and that's board transition. So as you know, we cycle every June. June becomes the end of a cycle for our board leadership. And so this will be my last month as board chair. Mike has been serving as the vice chair this last year and will assume the role of chair for this next year. So we called, during our last meeting, we called for nominations for the new vice chair for this next upcoming year. And I just have one. I have Russ Cashin has been nominated to be vice chair. I guess I could open it up for any other nominations. If there are any other nominations for vice chair before we proceed with voting. These were previously done by email, but I suppose we could take time if anybody else wants to nominate for vice chair. Okay, well, if there are no other nominations for vice chair, then maybe I could call for a motion to vote on our nominations.
I move to vote for the nominees for president and I'm sorry, chair and vice chair of the committee as Mike Moss and Russell Cashin.
Perfect. We have a motion. Do we have a second?
I second that.
All right, Dr. Kelly seconded. So before a vote, we have to call for final discussion. Any other discussion on the motion?
Thank you both for being willing to serve. I think you'll do a great job.
Thank you.
I agree.
And thank you, Matt, for serving so well.
You're welcome. Like I said, this has been a privilege to be associated with fine people and a very important topic. Okay, so if there's no other discussion, let's move to vote for the proposed motion. All in favor for the nomination of Mike and Russ as our chair and vice chair for next year, please indicate. Fantastic. Any opposed? All right, motion passes. Thanks, Mike and Russ, for being willing. I guess that will start at July's meeting. And we'll proceed with the next year's schedule of this committee. So this is great.
Matt, are you rotating off, or do you have a year left on your board term after June?
You know, I don't know. I think I probably have another year. Well, what was the term? There are term limits for leadership, but then there are also term limits for the board, I think, but I didn't review those.
I believe it's 4 years is the term limit for the board. But I know that the board is sunsetting in 2026, so it might just be worth keeping people on if that's okay.
I think I agree with Sarah. I think I have another year on my term to participate, which I'm happy to do because I think this is a worthy project. But as Sarah said, the board is sunsetting and then transitioning to the University of Utah structure, so they will oversee it rather than the Department of Health. So I don't see any reason why to enforce limits beyond 2025, because it will sunset or terminate July of 2026. So if anyone serving on the board will continue until the July 2026, I don't see any problem with that. And then the U of U can decide what they do with anybody else that wants to keep serving. So, okay, fantastic. And again, thanks everyone for serving. This is I think that again, this is important work, and I'm glad that everyone can contribute. So let's move to the guidance review schedule. This schedule was what we had last year, and it's a schedule for research review topics. The next one was going to be PTSD, I think, right? And then HIV/AIDS, epilepsy, and then that was it. 3 more topics.
Yeah, and to give some context, this was just something I found in the drive from when Sarah Ponce was still here. So I think it was like a estimated review schedule, but we can change the schedule and talk about new topics or different topics if we think that's more of a priority.
Yeah, so we can open that up for discussion. I will say some of these topics were addressed previously, but that's now 4 years old, and PTSD has been one of the more of a complicated topic with cannabis use, and I think most people agree it'd be worthy of addressing again. What we didn't have on here that we could do in conjunction with that is psychosis. That was mentioned earlier by Dr. Kelly, and I noticed Dr. Viner isn't here today. That's unusual, unless I don't see his name. Dr. Viner is a contributor from Nevada who's been very consistent contributor with our board and has offered to lend some of his expertise on a presentation for, about psychosis and maybe even more general mental health topics related to cannabis. So he has offered, and I think it would be a good idea. Maybe we could couple that with PTSD as a topic that we could do together. But does anyone on the board have any other discussion on this schedule for the rest of 2024-2025 topic review?
I just wanted to add, as far as the order goes, I don't know if I somehow got out of order, but I'm currently working on reviewing HIV and AIDS.
Oh, okay. So, okay. Let's switch that to the next one.
I think we had talked about, should we do PTSD, sooner, as, something that has so many patients are getting it for that indication, of like having it higher up from wherever it was in the order, Lauren. like higher priority. But if you're already working on something, I think that's good. I was looking at getting a speaker from outside the board just to give the board kind of the lay of the land of the thoughts from psychiatry on PTSD and cannabis use. And I've got some contacts. If anyone else has one, I didn't get a lot from the people I asked of a volunteer speaker to help out. So I guess if anyone else has suggestions of someone from the psychiatry end of things who could, similar to we've had other guest presentations on certain topics, since PTSD is such it gets a lot of attention and has lots of opinions. Yeah, Taylor, Beth is who exactly the first person I asked, of course. So I bugged her again last night to see in anticipation of the meeting today. So I'll follow up with Beth and see if we can get us someone from the psychiatry end of things as far as their views on PTSD, because I know there's some definite disconnect from what we see in a lot of medical cannabis use versus what we see from professional societies and their recommendations. And I think that could be helpful for us going forward. And then to give kind of some background context for all the data that Lauren will eventually find for us. But HIV/AIDS sounds great for a next one.
I agree, Mike. If when you compare specialties, psychiatry has been probably the most reluctant to use cannabis. I think for lots of reasons, much more so than maybe primary care or pain management or neurologists, because we've seen clear usage in those. But I think psychiatry has been very reluctant. But I would love to hear their perspective.
Does it seem okay for us to maybe hold off on that till our board meeting in October? Does that seem too soon?
Sounds fine.
Okay.
Whatever Lauren says.
Yeah.
Well, Dr. Mouse, I just wanted to clarify, were you imagining that you would have like the expert come and talk about it and then I would review the evidence after they've talked about it, or that would be like on the same occasion?
It could either be the same occasion, probably before you present your evidence. If that ended up being the same meeting where there are a guest speaker at the beginning and then you give us the evidence from your review, that could be even very interesting to have their guest take on some of that literature too. So that may take some back end coordinating of when all that would happen and speaker availability and things. So I would think having them speak before we hear from you, so we all have that context. Whether you would like to hear that before you do your review, I guess that's another question. Do you want to hear from one of them before you dig into things to give you a better look at it? We could also look at that, but I guess if our next meeting is going to be July, I know that may be too quick of a turnaround for another speaker. If you wanted to do that and then a few months later have that, I don't know what the right order is there to give everyone the best perspective
Mike,
on the information.
So we can also be flexible with meetings. I mean, when I joined this board, we used to meet monthly. We changed it to quarterly because we didn't have as much business to take care of, and it also gave Lauren 3 months to really complete the review. But if we want to have a September meeting with a presentation and then the October meeting be Lauren's presentation and separate it, that's well within our purview. So we don't have to be beholden to this quarterly schedule.
Why don't I look at securing a speaker? Lauren, do you have a preference on hearing something from that speaker before you dive into literature review?
I don't have a strong preference. I think it could be useful either way. I mean, it would be useful probably to have their insights on whatever I find when that's reviewed. It could be a little helpful to me to hear that beforehand, but maybe you should just try to see when the speaker would be available and try to schedule it around what works best for them.
Okay, well, I'll start there and then see what the flexibility is. I could also see the giving your most, unbiased or whatever your current bias is on your review and then hearing from whatever they have to say after the fact in favor or against.
Great. Well, let's give that some thought. I think a lot will depend on our availability for some speakers, and but I just wanted to make sure that we know that our meeting schedule is flexible. Okay, well, let's move on to number 8 then. Research education updates. Sarah.
Yeah, so I just have a couple updates. So this next newsletter, which will be going out in July, we're going to actually separate them. One of them will be more provider focused and one will be more patient focused. And we feel that that will be just a better way to give out information and more concise and just better for the readers in general. And that'll be going out through MailChimp. So it'll be a different format if you have been getting our newsletters. And that'll go out July 15th. And then this update is actually for CMCR, but or for the U of U, they'll be wrapping up their Sublime study in this summer. And I don't know if Taylor wants to touch on that at all, but that study has been really successful so far, and they've submitted their abstracts to various conferences and have been accepted to 5. And one of the upcoming ones that may be relevant to this group is in Canada, in Toronto, for the Research Society on Marijuana. I believe that's in July, and they'll be part of a symposium about cutting through the haze, bridging the gap between regulators and researchers to inform effective cannabis policy symposium. So they'll be with other states, and it'll be a really interesting topic. And I think our state is kind of unique in the sense that we have a really good relationship with researchers and providers and have that communication. So I don't know if there's anything else you want to add to that, Taylor, about the research that you guys have been doing with Sublime.
No, that's a great summary. I would say, one of the other potential benefits of all of this that you alluded to is that we have made some really good connections and even like the beginnings of partnerships with investigators and other policymakers in other states. So we have a pretty strong relationship with a Florida group. And Florida is really far ahead of the curve in terms of like the research and evaluation that they've done for their cannabis program. So there's a lot of possibilities to do things with them. We also have a good partnership with some individuals in Connecticut. Connecticut's a state where they've now moved to legalization of recreational cannabis, but for a while they were a medical cannabis use only state. So there's a couple individuals there who are very talented investigators who we work with. And then at least one member of our team has some relationships with a group in New York. So we're kind of building that network. And so if at any point we want to do anything that's collaborative or comparative between states or kind of leverage those relationships, I think that is being developed and will continue to move forward.
Thank you. And then to continue with the updates, we are going to have a booth at the Snowbird and CME conference in July. So that'll be July 31st to August 2nd. And we'll have just some information there. I think we're hoping to have the cannabis patient assessment tool potentially, if that's okay with you, Dr. McKiff, as something to hand out to providers and just letting them know more about the program. And even if they're not part of the program, just giving them some information. And then just as another recent update in terms of presentations, Rich and Dr. McKiff presented at the Ogden Surgical Medicine or Medical Society conference last month, I believe it was. I don't know if you have any updates from that, but it sounds like it went pretty well.
Yeah, I think so. It was fun. It's good to talk to clinicians and other providers on a one-on-one basis. So I think it went well.
Yeah. And then just as I know CMC is continuing to try to focus more on education and working with providers, if there's any opportunities that you guys are aware of that would be good for us to present at or have a booth at, just let us know, or you can reach out to me. I know we're trying to do more education in that regard. So those are all the updates that I have.
Thanks, Sarah. Yeah, just to go a little bit more on that, I think that personal discussions, I think, mean more. I mean, we provide these materials, which are great, but these conferences where you meet people one-on-one and hear their story, I think has a bigger impact. I bet several of you could attest to that. I know Russ probably could attest to that when you're teaching, students directly. I think it has an impact. So I like doing that and talking to clinicians and hearing their experiences. So yeah. I'll look forward to having more. And then Dr. Kelly, I'm glad to hear about this collaboration with other states. I think that we have a lot to offer. Maybe we're behind other states on the amount of research or review, but we have a lot of experience with collaboration with different entities. Like like Misty sits on the Cannabis Advisory Board, which was created because this board, our board, was being inundated with a lot of interest and things that were beyond our scope. And so we created another board, and our collaboration with the Department of Ag has been fantastic. Through the Department of Health and Department of Ag has been fantastic. We had success stories that we mentioned last meeting. So I think we can show how our communication, our collaboration has been excellent compared to other states where they might have conflicts of interest or they might have egos involved. I don't know. But this collaboration with other states, I think, needs to continue, not only with research, but with the regulators. And well, it'd be fun to be a part of it. And so it's really important for us to hear the review when people are involved. So. Okay, any other comments on that? Well, this is easy. We're way ahead of schedule, which no one complains about. So this is now our time for just open comment from the board. I took my time at the beginning of the meeting because I was really, keen on that and that another initiative that we could provide. Does any other board member have thoughts on a different initiative, a different thing we could do, or anything that we've done? Well, feel free at any time. Like I said, I think that we could expand our focus. I recently met through our organization with the Mayo Clinic, and I never knew that the Mayo Clinic, they have their logo has 3 shields, and the 3 shields stand for research, clinical care, and excellence, and teaching. I didn't know the third one stands for teaching. But that's part of their mission, is not only to conduct research and to conduct high quality, complex clinical care and management, but it's also to teach. And they're very involved in residency program. That's the capacity I was trying to. But anyway, I think that we could have a similar, not adopt it completely, but a similar focus. Like, we do all this great work, but we need to disseminate and teach. So I really am passionate about teaching. And so I look forward to any opportunities we can expand our reach.
As an educator, I appreciate that, Matt. It's, for me, I've always taken the point of view of focus on the patient, because patients often do a lot of self-education, and that leads to a lot of misinformation. And so trying to get them information that has some, evidence behind it, and that they can speak to their clinician about in an intelligent way is helpful. That's the point of my classes. And I'm going to take some of the material from what we're doing and incorporate it because it's helpful to me as an educator.
Exactly. And that's why I'm excited for the University of Utah to assume this role in this initiative, because they might find more ways to disseminate this information and teach. So cool. Well, if there's no other board comment, well, let's open it up to public comment. So all of you that are attending this meeting, they're not part of the board or the staff, if you are welcome to make a comment at this time. Again, we kind of have some rules set up. Please take no more than 2 minutes. Use the raise your hand function so we can do it in an orderly fashion and create a queue. And then please state your name and affiliation if there is any. And then Sarah Dash will kind of be our regulator of the clock and the queue. So Sarah, I'll turn it over to you. And it looks like Valerie is our first one in line.
All right, I'll start the timer.
I'm Valerie Ahnanu. I'm the Senior Manager for the Center for Medical Cannabis Research at the University of Utah. Really, I just wanted to, as Dr. McKiff just mentioned, we are supposed to be taking over this. So I wanted to potentially request with the board that we put some time on the docket at one of the upcoming meetings. It can also be next year or sorry, like maybe in the fall as we kind of get closer to the deadline of this to consider what would be valuable for us to consider to transition from what you guys have been doing, but also the interest of each of the board members to continue participating and in what capacity. And some of the things that we can team up with the Department of Health, just so that we have a plan and are doing some preparation to ensure nothing falls through the cracks, but that we're also still serving in the role that was intended from the sunset.
Awesome. Excellent. Well, thanks, Valerie, for being here. I'll comment. Again, this is open to any board members, unless we have another public comment. But we really appreciate working with you, Valerie, and the future that this could, where this could go. And I think you're right. I think we should start taking inventory of people, persons, contributors, and ideas, so that you can hit the ground running and really not have to reorganize everything. So Valerie, the content that you're going to release in July, where will that be released or posted?
So we'll be hosting it on our website. We'll also, my goal will be to put it also in our newsletter for that month and as a resource. And then I wrote down, follow up with Sarah Dash, and we'll get that over to you guys. And as far as it goes, we have a plethora of options of where we could also host it. We've been working on setting up social media channels, but also, Dr. Cashin is an executive member as well. So if he has some great ideas of wise places to put it for patients specifically, we'd be happy to take that inventory as well and get it posted wherever we can. The goal really is to kind of set the tone that this is something we'll be doing, and start conversations between QMPs, patients, and pharmacists, so that we're seeing some I guess growth and change, and maybe some entry of new providers that are interested in a little less fearful of having these conversations with patients. And just to comment, thank you, Dr. McKiff. I'll work with Sarah. I know you guys have agendas, so we can chat a little bit about what the timing looks like and what makes sense for these conversations as we move forward. And yeah, I really enjoyed the content today. I think there's a lot of resources that we can help promote. And hopefully it kind of feeds into making cannabis research more common. Because I think that as we see rescheduling happening, and with what Misty and Brandon are working on, it really will create, I think, more interest and kind of reduce some of those barriers that we know exist. So I appreciate it.
Perfect. Well, just as a quick response, I think one place I would add to that list of where to post these materials is in professional organizations. So the Utah Academy of Family Physicians, the Utah Academy of Physicians Assistants, the Utah, Organization of Nurse Practitioners, the Utah chapter of the American College of Physicians. I don't know if that's what it's called, Dr. Kelly, the internists, American College of Physicians, Utah chapter, I don't know. And then the Utah chapter of Pharmacy I don't know what they're called, but all of these are professional organizations that most professionals belong to. And they are really great ways to disseminate medical information if it's relevant to that group. And I think this is relevant to all of those groups.
That's a great idea. Thank you.
There you go, Dr. Good. UtahMed.org. Sweet.
Thank you, Taylor.
Any other public comment?
I haven't seen any hands yet.
Okay. Well, we appreciate attendance. If you're a part of the public, we appreciate your attendance and your contribution, if any, because this is both a medical and a public issue or topic. So we're glad that the program is moving forward and hope that it's helping a lot of people. So again, thanks for everyone for attending this call and for your contributions. Minutes will be posted, and we're going to meet in July. So we're not doing a quarterly this. We're going to meet in 1 month, right? What's the date of the next meeting, Sarah?
It'll be
The
the
9th.
second. Oh, yep, the 9th.
July 9th.
Mhm.
Okay, great. So after the festivities of Independence Day, we'll meet on July 9th, and the content. So do we have any homework before that meeting?
I believe so. I think we need to finalize the muscle spasms document, I believe. So going through that and just adding any changes and making sure that we have that ready to go. And then I'll send out an email with follow-up items too after Dr. Moss and I set the agenda.
Perfect. So yeah, please review the muscle spasm document that we reviewed last time, and then the Mike's document on the side effects.
And
and
then
yeah.
also, I would just add, just because we had the issues with the Zoom link today, just make sure to check UPN for the up-to-date one. I'll make sure to have one ready for next time so we don't run into the same issue. And I'll update the calendar invite. But yeah, so the old link is no longer going to work. So I just want to make that clear. And sorry for the issues this morning.
Great, thank you.
And Sarah, can you remind me, what is the date for the next meeting, just so I can make sure I have it correct in my calendar?
Yep, it'll be July 9th, 9 a.m. to 11.
Thank you.
Yep.
Perfect. Well, if there's no other business, do we have a motion to adjourn?
I move to adjourn.
Misty
I'll second
motion.
it.
Russ seconds. Awesome. Discussion or vote? All in favor to adjourn? Please indicate. Awesome. Looks like we have a majority. All right. Thanks, everyone.
Thank you.
Thank you.
We will
Thanks,
see you
guys.
next time.
Take care.